Welcome back to Health in Today's Woman. In our first segment, we talked a little bit about physical medicine rehabilitation and what that involves. In our second segment, we talked about some of the treatments of chronic pain. And in this segment, I want to take a little bit more of a turn into a specific pain syndrome, and that is fibromyalgia. Again, we're joined by Dr. Bill Newton, a physiatrist or physical medicine rehabilitation specialist from the Murfreesboro Medical Clinic. And Bill, I want to talk to you a little bit about this because this is one that we see on the TV all the time and hear about. And I know from my experience in medical school and stuff like this, it's a very difficult diagnosis to make. But I want to kind of start off with telling people, what is fibromyalgia? Just a real basic kind of understanding of what it is.
Fibromyalgia is really a very tough diagnosis. It's a chronic pain condition that results in widespread pain. We talk about it affecting multiple quadrants. If you think of your arms and your legs as each being a quadrant, affecting 4 quadrants. We talk about having specific tender areas within the muscle tissue, which are very specific and mapped out. We talk about it's a syndrome. It's not a disease. It's a syndrome, which is a constellation of signs and symptoms. Some other symptoms may include having sleep disturbance. Some symptoms may include having some gastrointestinal dysfunction, like irritable bowel syndrome, having an irritated bladder, having problems with incontinence, having problems with cognition, just kind of putting your thoughts together in your memory. Also having issues sometimes with restless leg. So it's a constellation of all of these signs and symptoms together with the widespread pain and the physical exam findings that help us with the diagnosis.
Well, I want to put up a graphic now because I do have a graphic of some of the symptoms that we often see. And the first one is really not a symptom, but it's usually female age 20 to 65. And I put it in there because not necessarily a symptom to the patient, but to the doctor, that's the first thing they're thinking about. Talk about chronic generalized pain, which you talked about. Fatigue, and I thought it was interesting, usually more than 6 months. So it's not just fatigue, you know what, the kids are keeping me up. It's a fatigue that seems to be longer lasting. You mentioned sleep disturbances. Right. Headaches is another one. And then, of course, irritable bowel syndrome are some of these symptoms. And is this pretty much kind of the things that you see in your practice that kind of tends you to think this is a possible diagnosis for a patient?
Right. And in most of my intake forms, we ask all these questions. You know, we ask about fatigue, we ask about sleep, we ask about bowel and bladder dysfunction, and putting all these things together kind of helps us with that diagnosis. The interesting thing is statistically, fibromyalgia affects men more than women. It's actually 20 to 1. So this is almost pretty consistently a female-related disorder.
So it's women more than men?
Women more than men, okay, 20 to 1. 20 to 1.
Yeah, I remember reading that. Now, the next thing, we have another graphic that I want to kind of show, and that's the whole idea of the exam symptoms. So when you go to the physician, they do an exam. These are the kind of things they're looking for. One of them was multiple tender areas and muscles and tendons. That seems to me like a pretty broad thing. And no inflammatory or joint disease. Can you go a little bit more into those kind of symptoms you're saying on your exam?
Traditionally, the diagnosis criteria actually comes out of the American College of Rheumatology. So a lot of patients who are actually diagnosed with fibromyalgia may present initially with generalized pain, joint pains, or arthralgias. They end up in a rheumatology clinic. They go through a full battery of examinations and blood work, which all comes back normal. So then the question is, you know, what is this? What are we dealing with? And that really kind of spurred this idea of this kind of generalized pain disorder that is non-inflammatory. Rheumatoid conditions are inflammatory autoimmune disorders that affects the joints or affects different organ systems within the body. So that's kind of where that non-inflammatory type of pain comes into play.
And the last graphic I want to put up here, because I think it's so interesting, is just what you mentioned. That's the whole idea that the